This is Navigating Cyber Risk podcast with me, John Riley, and George Usey as your hosts. Join us as we explore the challenges faced by executives as they grapple with new and ever-changing cybersecurity mandates. Welcome to Navigating Cyber Risk with your host, John Riley, where we explore the challenges faced by executives as they grapple with new cybersecurity mandates. And today, we have an amazing guest who will do a 50-mile bike ride as long as it's on an electric bike. He's a doctor of psychiatry and has his own podcast, The Virtual Psychiatrist. Introducing our special guest today, Dr. Muhammad Ali Rifai.
Thank you very much for having me. I appreciate being on your podcast.
Well, there's a reason you're on mine and I'm not on yours at this time, right? So we'll see about that one.
Absolutely.
All right. So we're going to just jump right in here. How would you explain the difference between cybersecurity and cyber risk?
From my perspective, cybersecurity is something that I live every day. It's an everyday. I'm a physician. I'm a practicing physician. I'm in the field of psychiatry, and cyber risk is something that I deal with every day. If I'm dealing with patients who are worried about their identity being stolen, if I'm dealing with insurance and conveying information to the insurance, if I'm dealing with billing and conveying the billing information to the billing systems, and we know we had the largest cyber attack ever recorded in history with the records of 191 million Americans being gone through Change Healthcare. They were my biller. They had my information. They had my own personal information. And it's all gone and it went out there in the dark web. So cybersecurity and cyber risk is they're kind of merging and they're coming synonymous, but we can talk about differences and how me as a psychiatrist studying the field of human behavior and psychology can be helpful in some of these instances.
Yeah, and that's what I'm looking forward to, because I mean, now, did you suffer any consequences from your information being out there?
Myself, I don't know yet. We're doing credit monitoring from Change Healthcare, but professionally, yes. So our business was not able to receive any insurance payments for about 3 or 4 months. We were zero revenue, zero money coming through the door for about 3 or 4 months from Change Healthcare until we were able to get a new clearinghouse for our billing with Change Healthcare and that issue. And we still don't know. I mean, the information of our patients is out there somewhere, and it's quite unfortunate situation.
I was traveling in the Philippines, and I got noticed that my information had been stolen from a bank. And then not too long after that, I started getting credit notifications that people were applying for credit cards and everything else in my name. And, you know, a lot of them were being denied. But it was one of those things that I had to experience. And
Absolutely.
I was able to lock down all of my credit and everything. But you don't realize that until you've been duplicated.
Absolutely.
Right.
Absolutely. So I've been on the receiving end, both personally and professionally, and talk to my patients who are on that receiving end. People think it's funny, but it's very sad, because what happened with that cyber attack is that the hackers started fighting. There was infighting among each other. So the company paid one group of hackers, and apparently there was another group of hackers that were not getting paid or didn't get paid by the first group of hackers, and they started infighting, and they still released information regardless of the fact that they were paid a ransom payment.
So I actually learned more about this. There's actually, it's a business. So the person that requests the ransom is not necessarily the person that does the hack. And so the person that does the hack, in this particular case, what happened is that the person that did the hack didn't actually get paid by the person that was the business side of it that actually got the original ransom. And so since they did the hack, they wanted their money, but they literally just, go figure, black market. They took the money and ran.
Yes.
It was worth enough that they didn't want to share it with the person and do the things that they were supposed to do in the hack.
Yes.
So it's as a business, untrustworthy people. Go figure.
So the ethics of hackers.
I think we might have a different podcast between the two of us on that one. Except we got to know more hackers. All right. So, so with that being the case, so what's the most significant cybersecurity threats facing companies today? Would you say, or maybe individuals? I mean, in your case, you're dealing more with individuals, right?
Yeah, absolutely, absolutely. I
So,
mean,
so what is the psychology behind those individuals, and how do they, how is it causing more problems with people?
sure. So now I think what's happening now is that we truly think that probably the information, credit information, or some sort of detailed information is out there about almost every American that lives in this country, and probably about everybody who's in the world, unless they live disconnected from the internet and live under a tree somewhere. And even then, there's still some information about them. And so the ability to connect with that person and kind of gain an understanding of that person, and this is specifically if there's a malicious attempt to extract information or understand what that person's preferences are, like with credit hacks, or is very easy. I mean, we humans are simple organisms. Even though people tell you that we were complex, we're very simple. There's a set of human characteristics that's not infinite, that's studied. And hackers who are expert psychologists are able to understand who are they hacking, who are they looking at, who are they targeting, because the personality types are there. I mean, there's multiple tests for personalities, but we know. I mean, it's a very limited number of personality types, and they're able to tell within few minutes of understanding a person where they're going to live in terms of the personality profile. I don't know if you've heard of the Myers-Briggs personality testing.
Sure.
That's just an example. I mean, there's multiple of those also, but it divides the humans to different groups, 16 patterns, and numbers and letters, and they all think alike. They're all the same. And the ability to tell which group does the person belong to is pretty reliable. I mean, it's pretty 80-90%, but they're able to tell who are you, what you prefer, what you think about, and so the ability to bring in an intrusion information is very, very easy once they know the information about you. So that's like, for me as a psychiatrist, it's very easy to deceive people and just convince them to do something that they normally would feel uncomfortable doing.
Now, are there any of those 16 categories that make it more difficult for somebody, or is it once you know which category they fit into, you can push the right buttons to guide them?
You can push the right buttons, and people talk about, well, what's a live large scale example. So, for example, we talk about, for example, with election, being able to identify through analysis, maybe on social media, who this person is likely to vote for just based on their Myers-Briggs. It's good. I mean, if you get it at 80-85%, that's pretty good. You're able to just their Myers-Briggs, the likelihood, who are they going to vote for? Are they going to vote this side, or maybe they're in the middle? And then you're able to target advertising. You're able to target malicious software, intrusions. So you're able to do any of those things.
Muhammad, I just got back from Vegas this last Saturday.
There you go.
I would definitely take 85% odds.
Yeah, there you go. Yes, absolutely, absolutely. Yeah, I mean, I think people just misunderstand that, and there's a lot of psychological testing and studies. So, for example, a lot of people, and I'll give you the example because a lot of my patients ask about that. So, for example, they would be talking about a topic with family or friends, and then a couple of hours later, they look at their phone and they see similar topics being offered in a variety of things, email, things to buy, or something like that. And they say, well, the phone was listening. In reality, that is not true because the software is not that specific. What happens is that because we're organisms, because we're humans, the group of humans who have the same characteristics are going to be thinking about the same thing at the same time, no matter what, whether they're in the United States, in China, in Russia. The people with the same characteristics are going to have the same things that they're thinking about. They're in the same stage of life, and so basically, they're able to identify that, okay, this person is from this group. They're probably in this scenario or this group. Let's offer them this. And as you said, 85% is good enough. So if they get 85% of what they're presenting to them, because of course it's not always that you think about something and you see it on your phone. Sure. Most of the time that doesn't work. But basically, if you get even 50%, people are going to start thinking, "Oh my God, my phone is listening to me." But it's only probability statistics that they're doing.
Well, that, and I mean, so one of the things that I saw was some of the statistics when it came to dating, like the dating apps. I think that there was an opportunity for, I think it was Match.com or Tinder or something, where
yes,
a young lady requested her data to be sent to her first of all, and then obviously deleted. And what she received was like this manual.
Oh yes,
I mean,
oh yes.
It was this gigantic thing, and they had it down to like when she felt lonely, and when they knew when she was opening the app and what she was looking for at the time, and everything else. So utilizing that and having that much information is quite interesting to understand the psychology behind it. So
absolutely, and then there's able to be predictive analysis in terms of a psychology. I mean, so for example, I tell you, as a psychiatrist or as a psychologist, somebody who's in this field, for example, we have a personality testing. So some of that Myers-Briggs also devies into a personality testing. One of the famous personality testing is a Minnesota multiphasic personality inventory. And we're truly able to tell the person. I mean, there's patterns that are similar to the Myers-Briggs, and you can design questionnaires that are on the web that will really tell you to the minute detail of where the person fits in their personality inventory without even talking to them, just with doing analysis of their life story, life circumstances, surfing habits, where are they on the internet, where do they go, what do they do, what kind of work they do, who their friends are, to a really, really very good probability of being able to tell who that person is and what's the best way to get in.
See, I think I'm pretty good at this stuff, but I definitely don't take it to that level.
Absolutely, and but this is what the cyber risk that's out there is, that they target, if they decide to target a certain place, certain group, certain for example, practice, hospital, they target the person, right. And they're able to present them something that they're going to feel comfortable with. They're going to lower their guards, and they're going to be able to cause an intrusion, or the person would agree to do something that they don't usually do.
Yeah, I think that also happens a lot of times. What I see is that happens a lot of times when somebody's distracted. So if they've had a loss in the family, they've lost a loved one or something, and they're just, they're still showing up to work, but they're not really there.
Mm-hmm.
That's also a prime time for those types of attacks.
Absolutely.
From what I've seen. Well, so so you're running your own companies, right? I mean, and so how do you prioritize your cyber risk as a company?
I run a psychiatric group, so we have even a heightened level of care for privacy, because under the Health Information Portability and Accountability Act of 1996, we have we're like a level 2 with psychiatric information and psychological information. So even if we're, for example, part of a large health network, there is a barrier, there is a lock to the psychiatric information. So we are very, very sensitive to that information. So, for example, I have my own electronic medical record system, and we don't mingle with the big hospitals, the Epics of the world, the large health systems. And part of that is that's how people come and see me, because they really value the fact that my electronic medical records are segregated. They're not part of a big health system where there's a possibility of a cyber attack, or there's a possibility of somebody breaking the glass and coming in and breaking glass is the term of somebody when they enter into a psychiatric record of somebody, they have to push a affirmative yes that I understand that I am doing this affirmatively. So if there's any issue in the future, that they understood that they are basically affirmatively coming into this electronic medical record. And to be honest with you, I have thought several times over the last 2 years whether I truly should return to a paper and pencil medical records and just abandon electronic medical records. Unfortunately, what happens is that we are stuck with electronic prescribing. So we have to do electronic prescribing in terms of our patients. But I really think about whether my patients' data and their medical records would be safer if they're just paper and pencil.
Coming from the world that I come from, I would say no, because I mean that could be just as easily stolen off somebody's desk or from a file cabinet or anything else. I mean, it's a, at least if I steal the file cabinet and if it's electronic, it's encrypted. So
Sure.
So I personally, I would still prefer that, but I mean,
but to steal a physical, there has to be a physical action. So there's going to be breaking into somewhere. Somebody's going to see it. There's going to be camera somewhere. So there's more breadcrumbs to go after versus the electronic breadcrumbs where that trail may go dry very, very quickly.
Quite possibly. Let me, I'll check back with you in like 2 years and see what you actually did with that one.
It's reality. I do know several psychiatrists who are still paper and pencil, and their patients value that because they know that their records are not going to be stolen, and they're not going to be with a hacker in Estonia getting all their psychiatric history and all their life story and using that to open a credit card in their name and understand their life and be able to steal their identity.
Agreed. Well, so I mean, do you have a CFO at your organization, or are you the CFO? You're wearing the.
I'm in a small organization, so I'm basically I am it in terms of. I mean, I do have a contractor that manage my electronic medical records. And the staff, basically, we robustly train on kind of just responding to inquiries and emails, and we're very, very sensitive who we email to and who we receive emails from, and sometimes even legitimate things that we distrust, we delete. We don't even answer. We don't even open. There's any links, we just delete it. And if somebody needs to get a hold of us, just do the good old telephone. Get a hold of us, and no electronic. And even with the good old telephone now, people are just. I don't know if you heard about that. Somebody took the identity of the White House chief of staff, and AI called other legislators in her capacity. So even the telephone is people are just becoming distrusting of it.
I had a friend of mine who's a doctor. He's a plastic surgeon, and he ended up losing a couple $100,000 because of a call that was made to the bank with his voice and everything else to verify a man-in-the-middle attack, and absolutely, was an AI version of his voice that approved it. How's that?
Absolutely, yeah, absolutely.
So it's getting interesting from that perspective. So, I mean, that kind of moves us on to the next question that I've got, which is, so what emerging trends do you believe will have a profound impact on the cybersecurity in the near future? I mean, AI is obviously one of those things. The video, the audio, these are definitely ways of taking over somebody. So how would if you're doing a Zoom meeting with somebody as their psychiatrist, right? Do you know you're talking to somebody, or are they putting on an AI show?
That's always a possibility. I mean, that's always a possibility. I mean, and I can tell you, I've been deceived before, like with legitimate information. I've been deceived by by somebody before, and they were trying to deceive me, and they used legitimate information and still were able to deceive me, but I was able to make things later on and understand that was deception. But it's very, very easy to deceive somebody these days, and so authentication, and just taking your time to make decisions. There's no rush. There's nothing that like I have had few patients who are like, oh, they called me. They said they're from the FBI. They're gonna come and arrest me. Well, let them come and arrest you. Like the FBI, if they want to come and find you, they're gonna find you. Like it's like there's no reason for somebody to call you. If they want you, they're there. So don't think that there's going to be somebody on the other side of the phone, that there's any urgency for anything. Unfortunately, but we're humans, and we're very easy to play on. And we talked about the Myers-Briggs, whether somebody's an introvert or an extrovert. Very easy to understand that and play on that psychological factor, and that would be a point of intrusion to be able to deceive that person into doing something that they don't want to do.
Yeah, very much so. Well, so I mean, you've got your data and you've got all your records. So what do you think that looks like if you had a cyber disaster and lost your records? I mean, how does what would that do for you? What kind of post-mortem would you have to do on your end?
So I've since last year, I've been preparing and trying to make sure that if we lose all of our data, that we have a plan B, C, and D. So we've developed a system where we do an offsite storage of all of our electronic medical record, and we try to back it up once a week. And so it's offsite on a physical drive and in multiple locations, and basically all the a paper record equivalent of all the records that we have, basically just like maybe 1 week late in terms of how often it gets updated. So we have backup. We want to be ready that if somebody says, well, somebody stole your electronic medical record that's in the cloud, what are you going to do? It's like we have a continuation of we're going to continue. We access it, and it's in paper. We're able to service the patient. We're able to continue to be of help to our patients, and then continuing vigilance with my staff. And it's very, very difficult. I mean, you have staff and you have staff that may be distracted. They go through their own issues. And sometimes my understanding, for example, with the Change Healthcare, the reason why they had a very robust system, but what happened is that there was a period where they were transitioning from Change Healthcare system into United Healthcare system, and then during that transition, there was some turning off of some of the security measures that they have, and that was the opportunity for the hackers to get in. And basically, so a period of transition that nobody paid attention to, and basically that was the opportunity for the hackers to get in. So being able to do that and just have my staff have an understanding of what's going on and the risks that we face, I think is very, very important.
Yeah, I think that risk there is always the case, and when a transition like that is happening, people are willing to take more risk. But then that comes to bite them, because they're trying to be more open with another company, or they're trying to transfer the records, and so then they're scaling back. But it just does increase the risk, and in that case, it bit them. So
sure, absolutely.
Cool.
And the consequences could be very, very catastrophic. I mean, an example is a local hospital in my area. They were taking over an oncology practice that treats cancer, and this practice had a database of pictures of patients for different body parts that are affected by cancer. So they had a database, but some of it were pictures, unclosed pictures. And what happened during the transition from that health system taking over this oncology practice, there was a period of lapse of robust security measures, and then hackers got in and they got that picture database and they threatened to release it. Now the hospital stood their grounds and said they were not going to pay a ransomware, and so the hackers ended up actually releasing the pictures into the web. Quite unfortunate, unclosed pictures of cancer patients out there on the web. And so the patients actually sued the hospital, and the hospital had to settle for a significant amount of money, more than was the ransomware that was being asked of them. So consequences are significant most of the time.
There's a show on Apple TV that talks about software companies, and basically they say, well, we got hacked. One of the episodes was we got hacked, and the guy goes, yeah, but so did this company, this company, this company, this company, and he lists off all these companies.
Sure. Yes.
And so he's like, yeah, it's no big deal. And ultimately that's kind of where I think that a lot of people live these days, is that their information has been passed by so many times. Now that's generally not nude body pictures and that type of thing, but I mean that's pretty extreme. But I can definitely understand where some people are coming from with my social security number's there. People have had it. I mean, so you do what you can to protect yourself from those items.
But I mean, there's still room for vigilance. That doesn't mean that they got. I mean, I don't think that it's like people asking. Well, it's a question of when I'm going to be hacked versus if I'm going to be hacked. So I think that doesn't help, because then it kind of lulls the person into a false sense of like, okay, I'm going to be hacked. That's it. Let me just try my best, and then it doesn't matter, which is quite unfortunate.
I mean, you will be. I mean, at some point, your data is going to be gone. Right now,
Yes.
Depending on what data it is. I mean, I think that's kind of where we have some struggles, because, like I said, I mean, social security number. I mean, I know mine's there, and my home address. All that information was leaked, and
Sure.
But I've got ways of protecting that. Now,
Absolutely.
If I was a cancer survivor and I had pictures out there, that might be a different situation, and that would be unfortunate, right? I mean, I think
Absolutely.
that sucks. I mean, I feel for the people that
Yes.
had that. So
the consequences are not just, okay, my social security got lost. It's like private pictures, private memories, private information that you don't want out there, and that bad actors may use to pressure you. And I think before we started the episode, we were talking about Amazon and that we bought the microphones from Amazon, and I pointed to basically an intrusion on the head of Amazon, Jeff Bezos, and how he was duped by an international player who is the head of a foreign country that he was communicating with on WhatsApp, and he sent him a link that basically took over his phone, and it took a long time for him to understand that this was what happened, and that he extracted all pictures, because he found out all of a sudden that his wife got a picture of him with his mistress. And how did she get that? It was the foreign leader who leaked that information to the wife, and they ended up divorcing.
Yep, one of the most expensive divorces in history, right?
Yes, absolutely.
All right. Well, so tell me, Muhammad, how did you get to be where you're at? I mean, the doctor of psychology and psychiatric, sorry, and everything else, and podcast. How did you get here?
A long journey. It's a long journey with a lot of adversities and a lot of successes. So I'm a first generation. My family is originally from the Middle East, from Syria. I did my training in internal medicine and psychiatry at the University of Virginia, and basically I focused on the field of psychiatry and medicine. And I was basically an early adopter of telehealth. Now we were meeting on Zoom, but I saw patients through telehealth in 2006 when it wasn't popular. It wasn't sexy. I mean, I know the COVID pandemic, the telehealth exploded, and Zoom exploded. I mean, Zoom was like an insignificant company prior to COVID. It was a small company that was trying to grow, but now look at it in terms of the business that it does. But prior to that, basically, we did telehealth from 2006 to 2020. And I was the go-to person when COVID hit because of my expertise in telehealth. I saw patients in rural areas. I saw patients in emergency rooms. I saw patients at home. And I was able to develop great expertise in the field of telehealth and was the go-to person during the pandemic. And so I was successful because basically the pandemic came and just excelled my career, being able to provide that information to other physicians, other health systems, and business took off since then.
Yeah, I mean, well, I mean, you increased your market share or your market ability, right? I mean, to be able to be out
Absolutely,
there and
absolutely,
work anywhere in the country and made it much. I think, and I think that's one of the cool advantages of the technology. Being able to uh, bring us closer together, where depending on where you're at. You're up there in Pennsylvania, and I'm here in Tampa, Florida, and we're able to bring this technology together to do this, and obviously, you were able to do it for bringing healthcare to
absolutely.
people that needed it, and your expertise, which is amazing. So, what's the current thing that you're working on that you're most excited about?
A little bit. I had a very interesting contract with actually a couple of social media platforms. There was a wave of, and I helped them design a program. So there was a wave about a couple of years ago of basically adolescents, underage individuals, or even adults who basically would experience psychiatric distress live on social media, and they would call for help or they would make threats. And some of these social media platforms were actually sued. So they actually came seeking help in order to be able to develop teams that would be able to hone in on those psychiatric emergencies and develop buzzwords for individuals who are facing distress, whether they're, for example, on social media or online, and you would be able to act on that perceived distress, and that actually, with the establishment of the 988 hotline, the government 988 hotline, which is now available on all social media, you're able to tag a 988, and that would bring it to the attention of a social worker or a counselor that would tend to the situation. If there's a threat of violence or a threat of self-harm, the person would come to clinical attention very, very quickly if somebody alerted basically the 988 system. So I think for a while there, I helped them developed keywords that you would look at, developed what they would look at, and that was very, 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 very interesting and very rewarding.
Absolutely. I mean, anything that helps people, I appreciate that because I mean, here I sit in cybersecurity, and we talk about data, but that's not necessarily having people on the line. So having people on the line, I definitely can appreciate that, and appreciate what you're doing with that. I mean, that's pretty amazing.
Absolutely, absolutely.
I like that. So why don't you tell me a little bit, so tell me a little bit more about your business. I mean, how can people reach you? What's it look like?
So I have a couple of businesses actually. So I have the brick and mortar private psychiatry practice. We are in Pennsylvania. I'm in the greater Lehigh Valley area. Bluepsychiatry.org is our practice. And we're very easy to reach. People can get us by phone or online. I'm on LinkedIn. I'm available on LinkedIn. I also have a podcast, The Virtual Psychiatrist, and I talk about a variety of psychiatric issues, and I talk about AI, artificial intelligence also. I've been very active in the AI field for a while, partially because of my involvement with telehealth early on. So AI came onto the scene also, and I've been involved with that, and I've written lots of articles about that. I also have a legal practice, and it's called SHIELD, Support and Help in Ethical Legal Defense. So I provide consultations to attorneys in relationship to the psychiatric aspects of crime, the psychiatric aspects of assessment of defendants, and assist lawyers in kind of just how to help their defendants, for example, if they're going to go to trial, or if they're going to plea, or if they have any issues related to their capacity for what happened when the crime was allegedly committed, and or assist judges if they're going to go through sentencing. And that's the job is the practice is called SHIELD, Support and Help in Ethical Legal Defense, and we're online at www.shield.expert.
Excellent. Cool. Well, I appreciate that. Well, so we like to end the show with, what piece of advice would you give to our audience? I mean, what actionable thing can they do, either from a psychological standpoint dealing with cyber risk, or just in general? What advice would you give to somebody?
It's hard. I mean, people don't trust anything these days. I mean, trust, but verify. So verification is very, very important, and trusting things is very, very difficult these days, because you could even if you trust something, you could get an illusion that it's something similar to. So taking your time, there is no need to rush. I mean, unless you're in a hospital and you're facing an emergency, a medical emergency, and you have to act immediately, there's no reason to act immediately on anything. There's no reason to be told to do something, get on your car and go grab money for somebody and do something. There's no reason to be doing that at all. Zero. Just take your time, cool down, verify, ask other people, because that usually thwarts 99.99% of attacks of that nature. If somebody just takes their time, verifies things. And so I tell people just to take your time and verify things. If it's not an emergency, just take your time.
Excellent. I love it. All right. Well, Muhammad Ali. I mean, first of all, I love the name, right? Muhammad Ali, Rifai. I appreciate it. You did a wonderful chat, and it's always good to get somebody from a different profession, and especially from psychiatric. I mean, that's not one that I've done before. I've got a really close friend who's a psychologist, and so I appreciate that.
My pleasure. My pleasure.
To our audience, thank you for listening. If you've learned something today, laughed, or do anything else, tell somebody about the podcast and get us out there. This has been another great episode of Navigating Cyber Risk with your host John and Muhammad here, and see you next time. Thanks, everybody. This was another amazing episode of Navigating Cyber Risk, powered by Omnistruct. Show us some love by subscribing and sharing today. Reach out to us with any comments, questions, or ideas about future shows by emailing us at podcast@omnistruct.com. Until next time, remember, governance is not a technology.